Hello. Today we're going to learn about the lower muscular system, in essence, the lower leg. Today I'm here to talk to you about this area of the cat. So from anatomical position, well, if the cat was laid in anatomical position, this would be the right leg. So I'll start here with the biceps femoris. You can see it's right here. And this just helps with the flexion of the knee and the overall movement of the leg. So if I remove the biceps femoris, you'll notice these parts. If you look right here, this is the gastrocnemius, which is also known as the calf muscle. And if you come here, the lower part right here is the semitendinosus, followed by above it the semimembranosus. And this also works with the biceps femoris to help with the extension and flexion of the knee. So if we move on from here, if I flip the cat a little bit over, I'll come over here. This part right here, this is the shin. It's also known as the tibialis anterior, so it's on the outside of the tibia. If we move more inward on the cat, I'll rotate it a little bit so you can see it better. So this is more of a top view. So this muscle right here, all throughout here, helps with the movement of this area right here. This is the Sartorius, also the S-shaped muscle, if that helps you remember. I'll move here, so now you can see it from a more anatomical position. So you'll see it comes from here all the way through here. It's this muscle right here. So when I move to the other side, you'll see that they're similar. This right here is the left leg, and this is also the tibialis anterior, the outside of the tibia. So like I mentioned here, this is the Sartorius. The other side we have, if we open the Sartorius, you'll expose more muscles. So this is right now the left side of the leg, and I'm looking from the top. So basically an aerial view. You'll see three parts right here, 1, 2, 3. This right here is the Vastus Medialis, which is because it's closer to the medial line of the entire cat. This is the rectus femoris that runs right through the middle of these two. This is the vastus lateralis. So if I review the three, this is vastus lateralis, rectus femoris, and vastus medialis. When I move over here, you'll be able to see this better. This is the gracilis, which also aids in the whole hamstring. So what it does is it helps aid the semitendinosus, semimembranosus in the flexion of the knee. So it's the overall movement of the legs. And if I put it back together, if I kind of try to put it back together and come here, this is what the entire area looks like from a more anatomical position. Thank you for listening. I hope I was somewhat able to inform you on some information that you may not have known, or possibly this could help you review. I apologize if the information was very brief, but I plan on explaining more in my presentation on the PowerPoint.